If you're over 60, your penis may be aging faster than the rest of your body, silently impacting your heart, bladder, confidence, and quality of life. I'm Dr. James Carter, a board-certified urologist with over 30 years helping thousands of men retirees, veterans, widowers, grandfathers stay strong, functional, and dignified. A 73-year-old patient, Robert, came to me feeling defeated. I'm active, but something's wrong down there. It's affecting everything. His neglect of simple penis care habits was quietly eroding his vitality, urinary control, and self-esteem. Penis care isn't about pills or performance. It's about daily habits most men never learn. In this video, I'll reveal 5 essential practices every man over 60 should adopt to protect sexual, urinary, emotional, and overall health, starting today. The 5th practice is rarely discussed, but can transform your confidence and connection. Before we start, if you're committed to aging with strength and purpose, please subscribe and turn on notifications for science-backed advice tailored for men over 60. In the comments, type 1 if this resonates, or 0 if it doesn't. I'm listening. Let's begin with the cornerstone of all function. Practice 1. Boost blood flow, your lifeline to vitality. Blood flow is the foundation of penis health. After 60, arteries naturally harden from aging, high blood pressure, diabetes, or inactivity, reducing erection firmness, sensation, and endurance. A 2021 study in the Journal of Sexual Medicine links poor penile circulation to a 40–50% increase in erectile dysfunction, ED, and a 30% higher risk of cardiovascular issues. I had a 71-year-old patient, James, who noticed fading morning erections. I thought it was just old age, he said. Tests revealed narrowed vessels knot disease, but neglect. You can reverse this decline. Daily walking, 30–40 minutes, and a diet rich in leafy greens, berries, nuts, and fatty fish boost nitric oxide, relaxing blood vessels, per a 2023 study in urology. Warm showers or gentle massages to the pelvic area stimulate local blood flow, keeping tissues responsive. James adopted these habits, and within 3 months, his erections strengthened and his energy surged. I feel alive again, he said. Blood flow isn't just for sex, it enhances urinary control, reduces nighttime bathroom trips, and boosts confidence. Start here to keep your body vibrant and functional. The next practice is simple but critical for comfort. Practice 2. Prioritize hygiene, guarding comfort and health. After 60, thinning, drier skin becomes prone to irritation, infections, and serious complications. A 2022 study in BJU International shows poor genital hygiene raises infection risk by 35–40% in seniors, causing itching, odor, balanitis, or even phimosis, tight foreskin. I had a 74-year-old patient, Thomas, who ignored chronic redness. It's nothing, he said, until it became painful inflammation, risking further complications. His inconsistent cleaning routine was the culprit. Daily washing with warm water and mild, fragrance-free soap removes bacteria, especially under the foreskin if uncircumcised, per a 2024 study in andrology. Thorough drying prevents fungal growth, particularly in warm climates. Thomas adopted this routine, and within a month, his irritation cleared, restoring comfort. I feel clean and confident, he said. Hygiene isn't just cleanliness, it's awareness, catching changes like redness, spots, or ulcers early to prevent serious issues, such as penile cancer, per a 2023 study in Journal of Geriatric Oncology. Respect your body with this daily act to maintain dignity and health. The next practice strengthens a hidden powerhouse. Practice 3. Strengthen pelvic floor, the engine of control. Your pelvic floor muscles support your bladder, prostate, and penis, but most men over 60 never train them. Weakening muscles lead to urinary leakage, frequent urination, weaker erections, or reduced orgasm intensity. A 2022 study in Urology links pelvic floor weakness to a 30–40% rise in urinary incontinence and ED in seniors. I had a 73-year-old patient, Frank, who felt humiliated by dribbling and soft erections. "I've lost control," he said, avoiding social outings. Pelvic floor exercises, Kegelston 15 reps daily, holding 3–5 seconds strengthen these muscles, improving erection firmness, ejaculation control, and bladder function. PER, a 2024 study in European Urology Focus. Frank practiced Kegels, and within 6 weeks, leakage reduced and erections improved. "I'm in charge again," he said. Kegels are discreet, requiring no equipment, and can be done sitting, standing, or lying down. Pair with deep breathing for relaxation. Think of your pelvic floor as your body's engine keep. It's strong to power sexual, urinary, and confidence health. The next practice connects your mind and heart. Practice 4. Foster intimacy and mindset. Aligning mind and body. Penis health isn't just physical. Your emotional connection and mindset are vital. Anxiety, fear of failure, or emotional distance from a partner can reduce blood flow, libido, and confidence. A 2023 study in Journal of Geriatric Psychiatry shows emotional disconnection cuts sexual function and mood by 20–25% in seniors. Many men over 60 also cling to youth-focused views of intimacy or feel shame, shaped by cultural or religious taboos. I had a 70-year-old patient, Walter, a widower, who withdrew from a new partner. "I feel like I'm failing her," he said, avoiding closeness. Open communication, sharing fears, desires, or hopes with a partner builds emotional closeness, boosting desire naturally, per a 2024 study in andrology. Redefine intimacy as shared touch, laughter, or affection, not just performance. Therapy or support groups can release stigma. Walter opened up to his partner, and their bond deepened, improving his erections and confidence. "I'm connected again," he said. Reframe intimacy as self-care, not pressure, and evolve your mindset to honor your current body, aligning mind and body for lasting vitality. The final practice ensures you stay proactive. Practice 5. Maintain regular health monitoring, preventing silent threats. Many men over 60 avoid checkups until problems arise, missing early signs of prostate issues, skin changes, or hormonal shifts. A 2022 study in Journal of Geriatric Medicine shows delayed screenings increase complication risks by 35% in seniors, from urinary tract infections to testosterone deficiency. I had a 71-year-old patient, Charles, who ignored frequent urination thinking it was normal aging. "It's just getting old," he said. Tests revealed an enlarged prostate, treatable if caught earlier. Annual urologist visits, blood sugar monitoring, and testosterone checks catch issues early, per a 2024 study in Journal of Aging and Health. Watch for skin changes, redness, ulcers, or urinary shifts, weak stream, dribbling, and report them promptly. Charles followed up regularly, and treatment restored his comfort. "I wish I'd acted sooner," he said. Monitoring isn't fear, it's empowerment, ensuring small issues don't become serious. Stay proactive to protect your health and independence. Comment 1 if you're ready to act, or 0 if this doesn't resonate. Daily plan to thrive. Integrate these sustainable steps. Blood flow. Walk 30–40 minutes daily. Eat greens, berries, or nuts. Use warm showers or 2-minute pelvic massages to stimulate circulation. Hygiene. Wash daily with mild soap and warm water. Dry thoroughly. Check skin weekly for changes, for example, redness, spots. Pelvic floor. Do 10-15 Kegels daily, hold 3-5 seconds, rest 3 seconds. Pair with deep breathing, track in a journal. Intimacy. Mindset. Share one feeling weekly with a partner or friend. Practice non-sexual touch, for example, hugs. Journal to release shame or redefine intimacy. Monitoring. Schedule annual urologist visits. Monitor blood sugar monthly. Note urinary or skin changes in a log. Support health. Drink 8-10 glasses of water daily. Sleep 7-8 hours. Eat fiber-rich foods, for example, oats, to aid bladder health. Overcoming stigma and embracing vitality. For many men over 60, penis care feels taboo or trivial. Cultural silence, religious guilt, generational norms, or personal losses like widowhood often frame it as shameful or irrelevant, fostering isolation. I've had patients say, "Doc, I thought this didn't matter at my age," or "I feel wrong focusing on it." But your sexual health, urinary function, confidence, and emotional connection are timeless, as vital as your heart or mind. Prioritizing them isn't vanity, it's strength, wisdom, and self-respect. You deserve comfort, dignity, and joy, whether alone, with a partner, or exploring new relationships. If you're hesitant, start small, walk daily, try Kegels, or share one thought with a loved one. If health concerns arise, consult a urologist or counselor. You're not alone. Over 60% of men over 60 face sexual or urinary challenges, and proactive habits help thousands thrive. One patient said, "I ignored myself for years, but now I'm strong and hopeful." Reframe penis care as self-care, not shame, and claim your right to a vibrant life. Education dissolves stigma, turning doubt into empowerment, isolation into connection, and resignation into possibility. Practical tips for success. Make these changes seamless and confident. Blood flow. Join a senior walking group, add berries to breakfast or spinach to dinner. Use a warm towel for 2-minute pelvic massages post. Shower. Hygiene. Keep mild soap, for example, Cetaphil, in the shower. Use a handheld mirror to check skin weekly. Wear breathable cotton underwear to reduce moisture. Pelvic floor. Practice Kegels during daily tasks. For example, while watching television. Visualize stopping urine flow to ensure correct muscle use. Rest if discomfort arises. Intimacy, mindset. Start with non-sexual touch. For example, hand-holding. Journal. One positive body thought weekly. Try mindfulness apps. For example, Calm to ease anxiety. Monitoring. Book urologist appointments annually. For example, set calendar reminders. Use a home blood sugar monitor if diabetic. Log urinary symptoms. For example, frequency, strength. Health. Use a water bottle with time markers, 2-3 liters daily. Set a bedtime routine for 7-8 hours sleep. Add oats or beans to meals for fiber. Check with your doctor if you have heart conditions, prostate issues, diabetes, or emotional concerns. After 2-4 weeks, note improvements in erection quality, urinary control, mood, or confidence to stay motivated. A 2024 study in Journal of Aging and Health shows proactive habits improve senior quality of life by 40-50%. Track progress in a private notebook or app to celebrate gains and maintain commitment. Building a support system. Health changes stick better with support. Share your goals with a trusted friend, partner, or family member to stay accountable. Join a senior health group, online men's health forum, or wellness class to exchange tips, stories, and encouragement. If shame, guilt, or grief, for example, from losing a partner, surfaces, consider a counselor or men's health support group specializing in aging and intimacy. One patient said, "Talking to my brother about my changes gave me courage. I wasn't alone." Involve your partner in open conversations about intimacy, health goals, or emotional needs to strengthen your bond and reduce pressure. Connection fuels resilience, turning small steps into lasting transformation. Addressing common challenges. Adopting new habits can be tough, especially with physical or emotional barriers. If walking is hard due to mobility, try chair exercises or water aerobics. Ask a doctor for safe options. If hygiene feels tedious, streamline with a handheld shower head for ease. If Kegels are confusing, practice with a physical therapist's guidance or online tutorials to ensure correct form. If intimacy feels daunting, start with non-sexual connection. For example, shared hobbies. To build comfort, seek therapy if shame persists. If monitoring feels overwhelming, set phone reminders for checkups or use apps to track symptoms. If fatigue hinders habits, prioritize sleep and small actions. For example, 10-minute walks. One patient said, "I resisted Kegels, but now they're empowering." Preparation and mindset turn challenges into opportunities. Conclusion: honor your body, shape your future. Thank you for joining me in this honest, science-backed conversation. If you're over 60, neglecting penis care risks your sexual, urinary, emotional, and overall health. Prioritize blood flow, hygiene, pelvic floor strength, intimacy, and health monitoring to thrive. My 30 years as a urologist show men in their 60s, 90s, and beyond can rewrite their health with intention. Walter rediscovered connection through these steps. "I'm whole," he said. "You're not bound by age. You're defined by your will to act." Start today. Walk, do Kegels, or talk openly. In my next video, I'll share a 5-minute plan to boost vitality for seniors, plus intimacy tips. Comment 1 if you're ready, or 0 if not, I'm listening. Let's make your next chapter vibrant, strong, and unapologetically yours.